So here there is another flow chart. You can see the hepatitis D virus infection which is infecting a carrier, and they can produce a fulminant hepatitis, and this is what I am interested about. Of course 80% cases you see here, they can produce a chronic hepatitis and cirrhosis, blah blah blah, but this is what I am interested. So let us discuss a question. A 23-year-old drug addict who was previously exposed to hepatitis B virus. He has hepatitis B surface antigen for more than 6 months. So this 23-year-old drug addict is a carrier. Now the patient gets another infection or another blood transfusion. We do not know what was in this blood, but following this blood transfusion, now the patient suddenly developed a severe onset of jaundice and liver failure. What is the most likely cause of this infection? So I repeat the question again. A 23-year-old drug addict who had a past history of jaundice. This patient at present gets another blood transfusion for something, and now following this blood transfusion, now the patient gets severe onset of jaundice and liver failure. What is the most likely cause of this disease or jaundice which is present now? So what is the answer? Is it a hepatitis B virus or hepatitis D virus? First of all, the answer is hepatitis D virus, because the clinical feature that I am describing here is a clinical feature of a fulminant hepatitis. So what are the point here? 23-year-old drug abusers, past history of a jaundice. It means the patient has a past history of a hepatitis B virus infection that we assume. Now this patient gets a blood transfusion. With this transfusion he gets hepatitis D virus infection, and these two infections come together, we get a superhuman firefighting or kind of something like that. Then patient gets the severe onset of jaundice, hepatic failure, and we get a fulminant hepatitis. So what is the answer? B or C again? It is always D. D or B again? It is always hepatitis delta virus infection, because D virus infection is also known as delta virus infection. Please don't forget it. You can expect a question on that. What is the most likely cause of fulminant hepatitis? If you have the option of both D delta virus and B virus, you should always pick up delta virus. Okay, the next session I'll discuss with you the liver morphology, but now I would like to say goodbye, and I'll record this next event when I shall discuss the liver morphology of acute hepatitis and chronic hepatitis. So I'll try to record it today later on. So goodbye for now. Thank you for listening to this lecture. So see the picture again here, and remember this. So we are getting a co-infection, we are getting a super infection with the D virus. So patient who has a super infection definitely has a past history of a jaundice, because the patient is a carrier with a surface antigen. Now the patient is having another infection through the blood transfusion. He gets the infection, and as a result of this thing you are getting a jaundice and hepatic failure. So which agent is responsible for this hepatic failure? Hepatitis D virus. Thank you.